If you're thinking of going flat after implant removal, in this video, I'm going to talk about the top 5 things you need to know about aesthetic flat closure after explantation. Hello there, I'm Dr. Wai-Yee Li. I'm a board-certified plastic surgeon specializing in breast reconstruction and breast rejuvenation. I work in a busy cancer center here in Los Angeles. In my previous video, I talked about aesthetic flat closure after mastectomy. This current video is for patients who are further along their journey, who've already had their mastectomy, they've had their breast reconstruction with implants, and now decide to have the implants removed and are thinking of going flat. So the first thing is, why do patients decide to have the implants removed after reconstruction? Well, there's various reasons. You probably know that current recommendation is that you get your implants changed every 10 to 15 years. Well, some of my patients, especially the older patients, they simply don't want to deal with that. You know, they've already had their implants for 10, 15 years. They don't want to get another set of implants. Other patients simply never got used to having implants or unhappy with implants or still feel a little uncomfortable with implants and request removal. Regardless of the reasons, it's important that you know what you look like after the implants are taken out, because it can look quite different, obviously. So for patients who are heavier or have big implants, those are the ones that are most at risk of having that hangy tissue, the so-called dreaded dog ears I talked about in my last video. And it's important that you address this with your plastic surgeon, especially if your idea is that not only are you having the implants taken out, but you want to be completely flat. So the second thing is, what about the muscle? So up until about 5 years ago, all implants after mastectomy were placed under the muscle in a procedure known as subpectoral implant reconstruction. So it's really important that when the implant is removed, if you want to go flat, that the muscle is sewn back down to the chest wall rather than being left to just heal randomly, because this can result in something known as animation deformity, which is completely avoidable and in some cases may need a second surgery to revise this. The third point is, what about the capsule? So the capsule is that membranous scar that forms around an implant soon after the implant is placed. What I typically do after I take out implants with no plans to put them back in is I do something called a partial capsulectomy, where I take out part of the capsule and then I cauterize or burn the remaining capsule so the two surfaces can stick down and heal. If you don't do this, one of the risks is something called chronic seroma formation, where there's build-up of fluid. So it's really important that this is done properly. The fourth question is, what are the risks of this particular surgery? Well, the risks of this surgery include the typical risks of any surgery, including bleeding, infection, and scar formation. The particular risk I already talked about is the seroma formation. So for me, I put all my patients in a breast binder after surgery, and I always use drains. The final question is, what about post-surgery care? So most of my patients can go home the same day. What you will find is that having implants taken out is actually a lot less painful than having them put in and having a mastectomy. And since most of these patients already went through that first surgery, they find the explantation is actually not that difficult to recover from. I hope you found this video to be useful. If so, please hit like and subscribe to my channel, and I'll see you at the next video.